Hi, good evening, everyone. Thank you so much for joining us for this thyroid eye disease patient and caregiver event. We are really excited to get started here. I'm going to go ahead and just walk us quickly through our agenda, introduce the Vision Health Advocacy Coalition, and then hand it over to our clinician speaker. And later on, you'll hear from a few TED patients as well. So if you could please go to the next slide. Wonderful. So a quick overview of our agenda here. As I mentioned, we'll do some quick welcome and introductions, as well as an overview of the Vision Health Advocacy Coalition. You will then hear from Dr. Kachikian on thyroid eye disease, kind of a thyroid eye disease 101 clinical perspective. And then we are very excited to have a Living Well with TED discussion with 4 TED patients who are also representatives at the TED community organization that you'll hear a little bit more about later on. We will have some time for questions at the end as well. So please, feel free to insert those into the Q&A feature as you think of them. We'll make sure to get those answers at the end of the session. Next slide, please. So just a little brief introduction of the Vision Health Advocacy Coalition. We are a coalition that works to promote patient-centered policies that make services, devices, and life-changing treatments more accessible for patients with vision conditions. And then next slide, please. And we are very, very excited to be partnering with the TED community organization for tonight's webinar. You'll hear a little bit more from some representatives from the TED community organization during our guided and panel discussion later on, but you can see a little bit more about some of the work that they do and the support they offer for patients with TED. Wonderful. So I am very, very excited to hand it over to Dr. Kachikian for our Thyroid Eye Disease 101 presentation. I will allow her to introduce herself. Dr. Kachikian, thank you so much for joining us this evening.
You guys so much for having me. So I am just one part of the puzzle. My name is Dr. K or Dr. Kachikian. I'm an endocrinologist. I live in Rapid City, South Dakota, and I consider myself a transplant, though I did all my training on the East Coast. Okay, next slide. Perfect. So this is why we're all here. What is thyroid eye disease? Thyroid eye disease is an autoimmune condition. An autoimmune condition is when your immune system doesn't recognize a certain part of your body as normal. It recognizes it as a foreign, and there's a misfiring of the immune system. And so what happens in thyroid eye disease is it is this IGF-1 mediated disease process, and it is against the cells that are on the surface of the eye and a surrounding area. And when these antibodies get activated, all of a sudden there's increased fat, there's increase in the size of the muscle that can happen. Next. All right. So who is at risk for thyroid eye disease? So when I was back in the day, when I was just a little resident, I was always told that 1 in 2 people who have Graves' disease can have thyroid eye disease. Having said that, thyroid eye disease is this very own entity. We used to say Graves' disease, but I will expand this further as we're learning more and more to say anybody who has autoimmune thyroid disease can have thyroid eye disease. All right, so who else? Women, unfortunately, are more at risk than men. Older patients are also slightly higher at risk. Smoking, like any other thing, can make thyroid eye disease worse in 5 to 8% of people. If I ever see a patient and I'm seeing them for their thyroid dysfunction, and they look as though they have any symptoms of thyroid eye disease, as a treatment modality, I stay away from radioactive iodine, because radioactive iodine in people who have any predisposition to have thyroid problems or eye problems can make it worse in about 15 to 20% of cases. And then obviously anybody who has a family history is at increased risk. Next slide. So what are the symptoms of TED? And our panel here is going to be much better able to tell you, and I think a lot of people in the audience will know better. But thyroid eye disease is a progressive disease. No 2 patients look the same. Sometimes you'll be at the mall and you'll see somebody whose eyes are protruding and you could tell, oh my gosh, this person is just like me. That protruding of their eyes is called proptosis. And again, it's because if you kind of think of an eye as a fixed box, if you know that you're having activation and the muscles behind the eye are getting better and the fat is getting bigger and the tissue is getting bigger, there's no place for the eyeball to go but to go forward. And that's what causes that bulging. When you get that bulging, you can also get this like stare, or people have like open eyes, and that can be seen. When you have the stare and your eyes are open longer, the front part of your eye gets dry. And when that happens, you can get redness. Your eyes are dry. It doesn't make sense, but they tear more. People will be crying, crying, crying all the time that it's affecting their vision. They can have sensitivity to light, which is called photophobia. They have the dryness, the grittiness, that feeling like there's sand in front of the eye. Um, they can have pain, and that pain is because of the muscle movement. Muscle pain can happen when you initially look like in one severe direction, but as it progresses, it can happen spontaneously. People will tell you they have headaches. People will tell you they have a hard time driving. And then the other thing I will tell you is it says eyelid swelling. You can get swelling of the eyelids above, below. You can get redness of those eyelids. But when I look at my patients now that I'm more prone to it, you get swelling along the entire face. And I think sometimes you appreciate this more after you treat people and you see how slowly the disease happens and what kind of symptoms are happening. So next slide. All right, you guys. So I kind of like this, and it's a little bit antiquated. It's a little bit not antiquated. So the way to think of it is active and inactive disease. But I tell people, like all autoimmune diseases, it kind of has this like ebbing and flowing pattern. It will activate and then it goes into dormancy and then it can activate at other times. So when your disease is taking an active role and you're having all these symptoms, I guess that would be considered active. Usually at the time of diagnosis, um, symptoms can happen between 6 months and 2 years. Sometimes people have thyroid problems that they don't present with eye problems for a long time. Sometimes people present with eye problems first. So it's important that you're here today so you can advocate for yourselves. But it's that progressive swelling of the tissue of the eyes, of the corner of the eyes, that grittiness, that burning sensation. And then what's the inactive stage? The inactive stage is maybe when you don't have um, continued swelling or continued changing of your eyes, but a lot of the symptoms we know will persist. In fact, when you talk to patients, up to 70% of patients who had symptoms when they first got diagnosed continue to suffer all the way, like 10 plus years out, because they still are getting headaches. They still have the dryness. They still have the grittiness. They still have pain with movement. So I think I think it's important to look at it in terms of context and look at it as a continuum. And I think it's important for us as providers and you as patients to advocate for yourself, because oftentimes when we don't ask our patients about it and they're suffering, that's what leads to a lot of the decreased mood that can happen with thyroid eye disease. Next slide. So this is kind of the picture like I was showing you. You know, you have a healthy eye, you have the eyeball, you have the pink, which is the muscle, you have the yellow, which is the fat, and then the soft tissue. And so when this disease gets super activated, you can see that the muscles are red and hot. The fat, which was just in one part, is now, getting bigger and bigger. And that sweet little eyeball has no place to go but to go forward. And then the eyes open more, and that's what's causing that redness, the pressure, the tissue swelling. And then in the inactive disease, even though your muscles have gotten so much bigger, they never go back to just being completely normal. The fat doesn't completely go away. So there's a lot of scar tissue that continues to cause issues for patients. Next slide. All right, so I think we addressed a little bit of this. Inflammation is swelling. And in this patient, eye specialists will call this something called the rainbow sign. So if you look at this patient right above her eyes, you'll notice that it's swollen almost like a rainbow. You'll notice that the eyes look like they're bulging forward, or at least, like the eyeballs look like retracted, or I like to think of it as a stare. Proptosis, I told you, is the bulging of the eyes. And then unfortunately, because the muscles are swelling and expanding at different times, all of a sudden it gives you double vision because the muscles aren't working all together. And that's called diplopia. In the beginning, it can happen in the morning where, you'll notice like your vision's blurry. Sometimes if you notice that and you cover one eye or the other eye, you'll notice things get better. And it kind of goes to show, oh, these are some of the early signs of double vision. And then it can continue to persist over time where you have it all the time. Next slide. So oftentimes what providers will do is we talk to our patients about the signs and symptoms, and we have this tool called the clinical activity score, where you get 1 point for all these different symptoms you're having, where it's pain when you look, swelling, redness above the eye, redness in the conjunctiva, which is the whites of the eye, a little bit of the bulging of the soft tissue from the bottom of the eye. So all these different things get a score. And if you have a score of 4 or more, that's considered active disease. If you have a score of 1 or less, then it's not considered as active of a disease. But honestly, for patients who have thyroid eye disease, it is a clinical diagnosis. It doesn't matter how many symptoms you have. It matters that you talk to your provider, you tell them about the signs and symptoms, and it doesn't just have to be at the time of that particular visit. It could be at different times along the way. In fact, for a lot of people who have thyroid eye disease, their symptoms are worse first thing in the morning because of the congestion that happens from laying down, and they get better over time. So both of these things need to be taken into consideration. And I think what's new in the paradigm or the world of thyroid eye disease is what doesn't matter as much is how long you've had the disease. It just matters what your clinical presentation is and how it's affecting your quality of life. Next slide. So this is a cool image. This is a CT scan, and you're looking at it in 2 different ways. You're looking at it where you're looking at it cut from the top down, and you're looking at all those muscles. And if you look at the muscles, and you kind of have to take my word for it, and you see 4 muscles, you can tell that the muscles are much, much bigger. And then the yellow arrow also goes to show you that there's inflammation of muscles, and it doesn't have to be symmetric. And that's what's causing the misalignment of your eyes or the double vision. And a CT scan is great, but what you can't appreciate on the CT scan is that there is a lot of swelling that's happening. In fact, there's a lot of swelling around the muscles that's happening too. So next slide. So what is our goal of treatment? Our goal of treatment is to get your eyes to calm down so you decrease the inflammation, reduce the physical changes. Oftentimes patients have noticed a significant improvement in the proptosis. You get rid of that gritty feeling, that dryness, and at the end of the day, the goal is to give you your quality of life back. Next slide. We keep talking about quality of life, quality of life, quality of life. When I see my patients for their thyroid disease, one of the questions I start asking them is, do you have any problems with your eyes? And if you have problems with your eyes, then I start asking them other questions like headaches, dryness, grittiness. And then the question I really, really like to ask, and this is a question you can ask yourself, so you can figure out, hey, are you a candidate for treatment? Are you not a candidate for treatment? Is this. I always ask them, how have the problems that are going on in your eyes changed your quality of life? What things can you not do now or don't enjoy doing now that you used to enjoy doing previously? We know that patients oftentimes can't drive, and it's terrible to be able to lose that autonomy. We know patients can't watch TV or read, which a lot of people need to be able to do their job on the computer. We know that it puts a lot of stress on relationships because a lot of times patients don't want to go out in public because they're bothered by the light or they're bothered by people pointing at them, and it takes a huge psychological toll. And all of this, causes a lot of stress. Somebody once told me that a patient who is newly diagnosed with thyroid eye disease scores on anxiety and depression as the same person as the same person who was given a new diagnosis of breast cancer. So I think it just kind of goes to show you that it very much impacts the person's quality of life. It very much does. And I think it makes us appreciate the autonomy that we have and how it can be robbed from us. And so all those things matter. Next slide. So this is that curve that we were talking about. This is called a Rundle's curve, where like you have the change in disease that's happening and then a static phase. And I will tell you, we have this, it's important to look at it, but now we know that this isn't really telling the full story. So we know that it can go up and come down and go down and come up. The disease is so interesting. Sometimes patients can have one eye that's affected, and then years later, they'll have the other eye that's affected. Sometimes it's both eyes. Some patients don't have any eye symptoms, so it's important to remember. Next slide. So what are the treatment options? So here's how I look at it. Thyroid eye disease is not a new disease. It's been around for a long time. And I think we've done a disservice to some of our patients because some of the treatment options have been limited. And so when treatment options are limited or they're not fantastic or the disease ebbs and flows, instead of trying to find new things, we kind of just don't ask patients about it. And I think that's a disservice. Um, so this is not like a new disease. It's just a new chapter or maybe a new volume to the story. Next slide. So treatment options. We know that thyroid eye disease is progressive. We know it's debilitating. We know that in about 8% of patients, it can cause vision loss. We know that symptoms are mild in some people and severe in others. And I don't think it's our job always as a provider to ask you who is affected more and who's not affected. Sometimes the people who don't have a lot of the symptoms on the outside are the people who are suffering the most, because I kind of like to think of it as if your eyes are bulging forward, at least there's space for them to move forward. If you're suffering and your eyes aren't bulging forward, then everything in the back of the eye is being compressed. And those are the people who are significantly increased risk of losing their vision. So what do I tell my patients? Simple things. Number one, watch for it so you can advocate for yourself. Always tell providers, hey, tell your eye doctor, hey, guess what? I had a history of Graves' disease, or I got treated with radioactive iodine, or there's a strong family history of Graves' disease in my family. Stop smoking. Everybody says that, but seriously, stop smoking. You can use eye drops. You can use gel eye drops at night. Maybe don't have a ceiling fan. And then there's been some studies that show taking selenium, like 100 micrograms twice a day for at least 6 months, can help improve symptoms. Some people will also say raise the head of your bed because that will help you. And then some people will also go so far as to say, and I know this sounds funny, but if you take saran cling wrap and you kind of like shut your eyes, because they're not always shutting at night, that can help improve the dryness significantly. Next slide. All right. So in the past, there was a couple of different ways that we would proceed. Steroids were a treatment option. Well, steroids are great because acutely they reduce inflammation, but steroids have lots of bad side effects that can also happen. As an endocrinologist, I hate steroids, and I jokingly say, which is not to say it's not a treatment option, but I always say people who give people high doses of steroids, I feel like they're cursing at me, which is not about me at all. But so steroids can make people feel super hungry, it can make people gain weight. If you have diabetes, it can exacerbate that. It helps because it cuts the swelling. So a lot of the pain that you're having is improved when you get rid of that swelling. Some of the bulging of your eyes will improve. Some of the double vision will improve. A lot of providers use steroids now as the first line to help get things under control while they're trying to figure out what the next step is in treatment. The only bad thing about steroids is when you withdraw them and you have to withdraw them slowly, all of a sudden you can get a resurgence of your symptoms. So that's kind of frustrating, irritating. You can get oral steroids or you can get IV steroids. So that's an option. Radiation used to be an option, especially if somebody is having acute symptoms. But with radiation, you're causing a little bit of damage to the tissue behind the eye. So oftentimes when we treat with radiation, we also use steroids because yes, we want the benefit of the radiation, but what we don't want is the benefit of the inflammation that goes with it. And now radiation isn't always the best option. So what has come onto the market? There are now biologics, which is what the world is going to. You see biologics in cancer treatment. You see biologics in rheumatoid arthritis or rheumatologic diseases. And here we have biologics in the treatment of thyroid eye disease. The only FDA approved biologic for thyroid eye disease is this medicine called teprotumumab or Tepro or Tepezza, which is the brand name. And I'm sure you've seen commercials for it. It is a fully monoclonal antibody against that IGF-1 receptor I was talking about. So you have this IGF-1 receptor that's upregulated on the eyes and it's waiting to do all these different things. And so these antibodies bind to it and all this downhill stuff happens. So what this medication does is it goes and binds to that receptor, and as a result, it blocks anything else from happening. The sooner in the course of your disease you can get it, the better off you are because now you're not having that downstream inflammation that you have to work backwards from. But we know that whether patients get it when they are having an acute exacerbation or if they've had the disease for over 2 to 10 years, it has been shown to have improvement. Patients say that it has improvement in terms of double vision, in terms of the bulging of their eyes, and in terms of symptoms. Next slide. Okay, here we go. So I talked to you about this already, and I will tell you a little bit about why that 2 millimeter reduction is really important. So oculoplastics, who do a lot of eye surgery, will tell you when they do surgery, which is, has been one of the options, and I think we'll have a slide about it before. When they try to reduce the pressure in the back of the eye, essentially they're trying to grind down the bone and they're like helping with the muscle. So if they do, and remember I told you your eyeball is in a fixed structure. So any one wall of their eye that they operate on, it's considered a successful surgery if they can reduce 2 millimeters. So that's how when this medication Tepezza was coming out, they said, well, like, is it going to be helpful? Is it not? Why did we get that 2 millimeter? That's how come we got that 2 millimeter to say, hey, if you do surgery, here it is. But surgery is definitely an option, and a lot of patients still need surgery. But here's the story. Surgery is just that. It's an engineering process. It is not getting rid of the acute cause of why things are happening. So the other thing I will tell you is it's 8 infusions given 3 weeks apart. It is important to commit to the treatment. I will usually tell people you need to be at the infusion center for at least about 2 hours. It has benefits, it has drawbacks. Almost all the patients I choose who start the medication, I need to choose them wisely. Hardly anyone stops treatment because patients will tell me they've suffered for so long that they would do whatever it takes. Having said that, muscle aches are very common. Nausea can happen. You cannot get pregnant on this medication. And if you do want to get pregnant, you have to wait for at least 6 months until you've finished your course of treatment. We talk about hearing. The medicine works in a lot of different ways, and I can talk to you about it. But one of the things that can happen is it can cause hearing issues. So in older patients, it can cause loss of hearing at higher frequencies. And in younger people, they kind of feel like they have a muffled sound, or they feel like their voice is echoing, or they feel like they're underwater. Most of my patients notice that their symptoms get better around 4 to 6 months after. 15% of people who have thyroid disease can have baseline hearing problems, so it's important. It's important for your doctor to make sure that if you go on this medicine, they get a hearing study and you keep them posted on what's going on. You can get high sugar levels if you have had diabetes. If you are on the borderline, those are the people who are the most affected. In my patients, for sure, their sugars will get a little bit worse, but then they get better within about 3 to 4 days after they've gotten their treatment. And some of them will notice an exacerbation in their diabetes. And again, things seem to come back to normal about 3 to 4 months after. Next slide. So a picture's worth 1,000 words. Here you can see in this patient that they have a lot of redness in the whites of their eyes, which gets better. I know you can't necessarily appreciate this, but this patient has double vision, and that little white dot that should be directly in the center of the eye is off alignment, so you know they're having issues. You can see on this slide that they have inflammation not just above their eye, but also below their eye when you've given them treatment. So a lot of different factors. So next slide. Surgeries. So I was actually just talking to an orbital surgeon, and this is what they said. They said most oculoplastics will say they prefer the infusion over doing surgery. Not to say surgery is not an option, but this is what they do. They say surgery is never a one step. You start off with that orbital decompression where they're grinding down the bone, they're realigning muscles, and they always say, well, hey, listen, here's the story. I'm gonna have to put you under general anesthesia. I can only do one eye at a time. When I do surgery on your eye, it's very possible that I could cause it to get a little bit more aggravated. So we'll treat one eye. We'll see how you do. We'll give about a month. We'll wait for the eye to calm down. And then if you're better, we'll go back in and do the other eye. And then the next step after that is once, there's more space, then I'm going to go in there and mess with the muscles so that I can realign them for you. And so that should help you with your double vision. And then once all of that is done, I'll help you with your eyelids so that you don't feel like your eyes are bulging. And I will tell you that the surgeons have had amazing results. Patients look much, much better. But think about how much PTO you have to take. Think about how much FMLA you have to take. Think of what the costs of it are. So yes, a lot of patients still need surgery, but I think more and more Eye specialists are trying to see what they can do to fix the root problem of the disease. Next slide. So what can you do? You can go on and find a thyroid eye disease specialist. You need to work with your primary care doctor, your eye doctor, and a lot of times patients see oculoplastics. You see somebody who has an interest in thyroid eye disease. You can see your endocrinologist. You can recognize what kind of effect it has. You can do those simple things like stop smoking, use lubricating eye drops, see if you can reduce stress. Um, and then this is the best part. You have an entire coalition of people who are here by your side who know firsthand what they're dealing with. So next slide. All right, you guys, I'm gonna stop now and I'm gonna let the real heroes talk to you, and then I'll be here in the background if we have any questions.
Thank you so much, Dr. Kutiki, and we really appreciate that presentation and a great kind of introduction to our, our panel discussion that's about to happen here. As Dr. Kutiki mentioned, we will have time for Q&A at the end of our webinar. So if you do have questions, please feel free to submit those in the Q&A now or as they come up. So I am very, very excited to be joined by 4 TED patients and representatives from the TED community organization for a panel discussion here about living well with TED. And I'm going to start things off by allowing everyone to introduce themselves. So maybe Christine, you can start us off and introduce yourself.
Sure. Can you hear me okay? Yeah.
Yes.
Yeah, thank you so much for having us here, and what a great presentation on TED. I mean, I've got it when I was in 2009, so you think I'd know a lot, but I learned some things today. Thank you for that. So I'm Christine Gustafson, and I am a TED patient, and I'm also the executive director and the CEO for the TED Community Organization. It's a nonprofit specific to thyroid eye disease. Lots of free and fun things that we're doing. So, and I got thyroid eye disease in 2009, and this was before there was any idea of treatments or any kind of thoughts about biologics. It was called Graves ophthalmology at that time. So yeah, so my story goes way back. Yeah, thanks.
Thank you so much, Christine. And Jackie?
Hi, my name's Jackie Booker. I'm also from the TED community. I am the director of our TED Art. I got TED in 2020, in February of 2020, and I actually took treatment. So I did take Tepezza and completed that in 2021.
Thank you so much, Jackie. And Nathaniel?
Hi, my name is Nathaniel Jelinek. I'm involved with the TED organization in the educational aspect. My background is that I'm a physician as well. I'm also a man. We've heard many times it's mostly a disease of women. And I'm someone who doesn't have thyroid disease per se, but has thyroid eye disease, just to show you the range of people that can be afflicted with this condition. I've had TED for 2+ years now, and have had pretty much every symptom that was listed and multiple treatments and rounds of treatments. I'm happy to talk about that if people have questions.
Thank you so much, Nathaniel. And Gail?
Hi, my name is Gail, and I was diagnosed with TED and Graves at the same time in 2018. I just want to say, Dr. K, that was the best explanation I ever heard anybody go through in detail about the journey or what could happen with anybody with TED. I went through the steroids. I did have the radiation treatment, and then Tepezza was approved. And I also did that in 2020 and finished that journey in 2021.
Thank you so much. Well, I just want to say thank you all again so much for joining us this evening. I want to, kick things off here with our discussion. So often we talk about the numbers, we talk about the data, and we forget the patient stories. We forget about the experiences patients are having, how, these conditions really impact patients in their life. And so I want to kind of start things off here with, maybe having a discussion about how TED has impacted your life. And maybe Christine, I can come back to you and have you get us started.
Oh, sure. Yes. So, yeah, it's a really a interesting, what I call the TED journey. So for myself, when I first got thyroid eye disease, and like Gail, I got Graves' disease diagnosed at the same time, and both were presenting like at the top in terms of the endocrinologist said my numbers were the highest she had seen. And already my eyes were bulging out and my eyelids were retracting. My eyes were very red. I was scaring children. When they saw me, they would tend to hide behind their parents, sometimes start crying, just because I looked pretty spooky. And I didn't know anybody else that had thyroid eye disease. It's a rare disease. And so it's very unusual to meet someone in your own community that has it. But part of what happens when you have thyroid eye disease is that it causes you to withdraw, to like not want to work, not want to be around friends, to just certainly not be around children or cameras or mirrors for that fact, so it is a real change to like if someone has confidence at a 5, 6, 7, like most of us, it goes to a 1, 2, maybe 3 on a really good day, because it's really hard to have confidence when one, your eyesight might be affected, but the other is just visually. I felt this, and people tell me in the TED community, they say, I look in the mirror and it's not me. Like, where did I go? That's not my face. And so, like Dr. K said, it affects not just our eyes, but that same fat, it like kind of drains down our face, I guess. And so we get some of us get these big round faces. It's really disorienting. I went 10 years before I met anybody who had thyroid eye disease. So I really didn't have a good handle on it. And there was, like I said, not a lot of treatment. And so for me, they said, you just have to wait and see. It runs its course about 2, 3 years. And after it runs its course, then we can think about surgery if you need it at that point. Well, by then my eyes are dangling out of their sockets and I'm thinking, if I need it, are they going to just automatically go back in? Like, do you have like some way to do that? And I was really suffering a lot of pain. I would wake up in the night just in so much pain. And it was like pain that's behind my eyes. It's not like this one doctor said, well, just use more drops. I go, but it's not on the front of my eyes where it's hurting. It's in the back. And it's so painful, I can't sleep. And so, anyway, in my case, I had 7 surgeries to put my eyes back in their sockets and then to like normalize my look. I'm around little kids. I swim every day and I go to a sports center and there's always children around and they'll come up and talk with me just about their new dress or, that they got in the pool today without crying, something like that. They don't recognize there's anything wrong with me now. It's a really such a wonderful thing. Yeah.
Thank you so much for sharing that, Christine. And, I know having, the moments of having, just a discussion with someone and not having them think about your condition first and just seeing you as a person and as an individual and how important that is. Maybe Jackie, you can share a little bit from your perspective.
Yeah, in my journey, kind of like Christine was saying, it's very painful. Your eyes hurt, a lot, obviously. Very dry. When I got a diagnosis, I was also diagnosed with Graves and TED. But your eyes are so gritty, so red. And at that time I was still working in the office. And in my case, I got this in February of 2020, right? And then the pandemic happened. So then we started working from home. So that was helpful because then I could control the lighting. I ended up needing to wear a hat, sunglasses in my house just because I couldn't withstand the light. So the light sensitivity was very difficult. And then, you know, just the journey itself to get a diagnosis and then get on the medication. That was a long journey. So 8 months it took for that. And I did, and I listening to Dr. K, and I want to say thank you too. That was very great, everything you were talking about, because it's so real what's happening, you know, to patients. But I saw that you had like chimosis, caruncle. I had that. So I had a lot of disfiguration with TED, you know, with that coming out of my eye, the facial changes, you know, just like Christine said, the only difference, I didn't have any interaction with anybody because we were working from home. So in that case, I felt fortunate, if you will. Yeah. And then also we had an outage in the medication. So that was kind of terrifying because, you know, you're getting a result on something and then you got to stop it and then restart. So that was kind of my journey. Yeah.
Thank you so much, Jackie.
Mhm.
And Nathaniel,
Yeah, I mean, I think everyone's journey is different, but they're all marathons. None of them are sprints or 5Ks. And we need someone like Christine to see how she's overcome it in with really no support too. So it's really important for us to have that role model for us as to getting to the other side. I mean, I think I've learned from my own experience and everyone I've talked to that the disease affects every part of your life. So it certainly affects your self-image, which people have talked about, and that affects your mood. So it's very frequent for myself and for people I talk to have depression or more anxiety, and confidence problems that you didn't have before that really are directly attributable. And Dr. K mentioned the impact of that likened to someone who can have a diagnosis of cancer. And the quality of life studies support that. It's really an out of control disease. You didn't do anything to get this disease, and it's your body attacking itself. And it's sort of a shared thing among people who have autoimmune diseases that you're afflicted with that particular condition. You want to turn it off, but you can't. And then because of that, there's just a lot of science and unclear science about what you can do to turn that off, and that can be confusing milieu. And I agree. I think the social consequences of having this are severe and significant, because the easiest thing to do is to withdraw, not see your family and friends. If you haven't seen someone for a while and you get thyroid eye disease, it's the first and only thing people see when they notice you for the first time. And so it's just an explanation after an explanation. You just don't feel like yourself. I very much had like facial swelling in addition to my eyes. I remember my doctor was talking just about like my whole forehead and upper cheeks, everything was swollen. And that as I've responded to treatment, you see everything just sort of shrink down. So that's the ideal situation. So yeah, just overall impact pretty holistically significant for me.
Well, I didn't go, so I'll go next. Is that okay?
Yeah.
yes, apologies. I think my internet may be cutting in and out here a little bit, so apologies if it looks like I'm staring off into the nothingness here. But Gail, yes, please go ahead.
Okay. I would say that how my life was greatly affected was, uh, many of the things that Jackie, Nathaniel, and Christine just said. A lot of isolation. I was not working at that time. In the beginning, I just didn't understand. I didn't know what I didn't know. And my eyes were really dry and I rubbed them severely. And I ended up giving myself a cornea abrasion and lost my vision in my eye for a period of time. In my double vision that I had, I saw straight with one eye, and then my left eye pointed in and down. So I saw a double vision like this, straight and then, down and in. So I winked a lot. Did lose that privilege to drive for a period of time. So that really is a very difficult thing, especially when my daughter lived out of state at the time, and I lost contact with um, being in my grandchildren's life when they were really young, especially my second granddaughter when she was born, because I couldn't drive to go see them. So that, that was really a difficult time. Um, um, I think that, so many things my husband wanted, well, let's go here, let's go there. But, as many I already said, there, what, I just wanted to stay in the house and get on my sewing machine and sew and make something as the best that I could and wink like heck so I can actually, feel accomplished and that I did something successful for myself.
So I have a
Thank you.
question, Gail. Can I ask a question?
Absolutely.
So when you were doing your quilting, so you did quilting, right? Did
Yes.
you see that it would look different or anything? Because you were doing it while you had Ted.
Yes. Yeah. The lighting was a real problem for me. I had so many lights around like the base of my sewing machine so I could see exactly what I was sewing,
Mm-hmm.
because my vision was off, and I would wink all the time as hard as I could because so I could see straight.
Right.
I mean, I can laugh at myself now, but that was really hard. And one of the things, I made a quilt, like a wall hanging, for a fundraiser, and I really thought it rocked. And
Mm.
then, like, I couldn't really see. I always had to wait till the next day and look at it in the daylight. And there were so many holes in that thing. So, I mean, I can laugh about that. Then I
Mhm.
knew I had to fix when it was daylight. But, it went really well with the auction for this fundraiser. So I was really happy in the end. But I felt like I didn't want to give up and I wasn't going to quit. And I was going to do what I could that I could control because there's so much that you can't. And
Right.
you just kind of go with it. And, it's a hard thing to do, but thank you for asking me that.
Yeah, I kind of had the same thing because I like to take pictures, and I continued to take pictures, even though I couldn't always see it. Double vision, it was blurry, but I continued. Later, I looked at all that. When I could take a picture and actually focus, something that you could really tell what it was. But it was pretty awesome because I'm with you. I had to just keep doing and keep pushing forward so I didn't, go to darkness, because you very much so can. It's very
Very
depressing,
well.
you know.
Agreed. I agree with that.
Yeah. And I did lose my driving privileges also for a while because I couldn't see. But yeah, gratefully I can see now and I can drive. So that's
Amen. Yes. Or the first day my husband finally said, okay, I could drive, I remember that day. It was so funny. I went right to the fabric store and then I went to another fabric store and then I went to the library. And after 3 hours, he texted me, is everything okay? Like, freedom.
Exactly. I can go somewhere.
I know. Great.
That's great. Yeah.
Well, I think you're all touching on, something that we'd like to talk about a little bit that I think is such an important, part of this journey is how you kind of find support, how you kind of, whether it's, through taking photos, through sewing, through finding communities like the TED Community Organization, ways that you kind of worked through this journey. And maybe Christine, you can talk a little bit about, the TED Community Organization and some of the work that you guys do.
Yeah, thank you so much for asking that question, Olivia. The TED Community Organization really came about when someone said to me, just in a very casual conversation, that I was trying to help someone that had TED. By that time, I had met a few people, and I was telling this woman, I said, it's really hard to find information because it's so scattered. You just go to Dr. Google and you're getting so much misinformation and information, and it was a lot. And so she said, well, it's because there's not a dedicated nonprofit for thyroid eye disease. And I'm not from the nonprofit space, so it wouldn't have occurred to me. And I said, well, is that important? And she said, very. And so I started looking into it, and I found out that she was 100% correct. and that there was no central education, no central support or community. And so I just started, I'm a website designer that's my profession, graphic design. I have a studio. And so I started putting together like surveys and putting things online, asking people if they thought this was important, and it was 100%. And it seemed like in no time at all, this was in February 22nd, 2022 is when I bought our tedcommunity.org domain, just thinking, well, we'll just experiment, just see if there's really a need out there. And then, I mean, now we're global. In that short of a time, we're global, and we have so many things. So our main thing is the thing that I experience the most is being alone. And so what we want to ensure that no one needs to walk alone through the TED journey. So that's where, like, each of us on this call are, we each have things that we can bring to the TED community that opens a door for someone. Maybe it's doing art like with Jackie, or like Gail, she has Dear TED E, and people can write in questions, and then she contacts a physician, or if it's like a care partner kind of question, she'll take it to them. And we have just seen, we've done some in-person, we've gone to medical conferences, we have some online support groups. And right now we're partnering with people in the UK. And so they come to our support groups too. So we have really are branching out like very quickly because the need is so great. And the only thing that I want to add to that is, as we're looking forward, you brought up quality of life, and so did Dr. K. And we have found that it is the greatest unmet need for the TED patient, because if you get like something like a biologic, there is Tepezza, and there's more on the way. There's a lot of research now and more biologics really, what I'd say, in the oven, cooking. And so we will have a lot more solutions coming up as well. But TED seems to stay around. And so this whole question about quality of life is not solved by a biologic, and it's not solved by a lot of surgery. Is that, we really need to address what the person is going through who has TED. And so that's part of our 2025, what we'll be working on. But we recognize that as, a very high priority for bringing that type of education and support to the person with thyroid eye disease.
mean,
I just
for
want to hone
me,
in on that too.
yeah.
Oh,
Go
sorry.
ahead, Jackie. No, you go, Jackie.
Oh, I was just gonna say, to me, like the first time I got to meet somebody that had TED that was just like me was amazing. Because in the beginning of my journey, I didn't know anyone. I had never met anybody with thyroid eye disease. You just had to search the internet, all over the place, like Christine had said earlier. And just having a community where you can meet other people, you can talk, it is so helpful, just to our mental health.
Yeah.
I agree.
Having the shared experience
Mhm.
for a rare disease and using the virtual support groups was groundbreaking for me to be able to have that community. And I don't know if you remember, Christine, my first group was the first day I was out of work for double vision, because I worked as a surgeon, and while I'm back to work now, I was out for about 4 months because I couldn't operate safely. And that first day was a support group meeting for me. It was exactly what I needed.
Yeah, I still remember we did highs and lows, and he said, well,
Mhm.
my high is that I get to spend the day with my dog. My low is I can't work because I have double vision and I'm a surgeon.
Yeah.
It's like, wow, okay, that's why we're here. Perfect.
Mhm.
Yeah.
Yeah, that's really awesome.
Yeah, I mean, I can't thank you enough for the work that you do. I think as you all mentioned, it's so important to have someone else who kind of has, an experience. Every patient is different, but having that kind of similar experience, no one else understands it better than you. And and others kind of in the same boat. And I think that's, you know, such an important, you know, point to bring up, and such important work that you guys are doing.
I bring up a question just to ask. Can you give any advice? I mean, you guys are great and you actually look amazing. Do you have any advice to give to people who are listening out there who are suffering? Like, did your doctors bring it up? Did you guys advocate for yourself? How did you get to your journey? Because a lot of studies show that it takes people at least 3 to 4 years to get to the right person.
Mhm.
I know about that. I went to 5 doctors before I was diagnosed, 3 of which were eyes. And the doctor that did diagnose me was an eye professional, and she sent me for a CAT scan and blood work. And because she was the 5th doctor, and when she sent me there, I mean, it was almost terrifying because the other one just gave me an eye drop and sent me on my way. So that's what it kind of felt like, as she was going to do, like the next person. And so to be sent for a CAT scan, it's like I got hit in the head with a brick, kind of a thing. But she was a stellar physician. She ended up having to refer me on to my neuro-ophthalmologist that I still see. And then from there, I met the ocular plastic. So it definitely is a journey. But so I would say I started going to the doctor in February, and I was diagnosed in September of that year, but didn't have any active symptoms until February of the following year. Other than the tearing, I had tearing the whole time. That's why I kept trying to seek what the issue was. I will say the allergist thought that he was the 4th doctor. He thought maybe you have dry eye, because my eyes weren't bulging. That the only symptom I had was the dry eye and the constant tearing. But there's such a big, you just don't go buy eye drops. You really know what you're looking for. It has to be non-preservative. But if you don't really know all that, I advocated for myself. I would go in there with a list of questions every time, and you learn that. I didn't used to be like that, but I'm like that now with my parents, and I ask a lot of questions, and I don't stop. I'm probably annoying to some people, but I want to know. I may not. And I used to tell my doctor, I don't want to hear what you're saying to me, but I don't want you to lie. I want you to shoot me straight. I'm not going to like it, but at least then I'll know and I'll understand, and I can work through it. And sometimes leaving that neuro-ophthalmologist, I felt like I was beat. It was rough. So
What you're saying is so right. So a lot of the guidelines and stuff are changing, which you know, you'll kind of notice, like now the recommendations from the American Thyroid Association are, when you see your patients with thyroid disease, make sure you ask them about their eyes. That's considered best practice. And then the call out for eye doctors is dry eye disease, which is what you mentioned, Gail, and thyroid eye disease can kind of overlap. So if you have a patient and they have dry eye symptoms, 60% of them, if they're not getting better, because that's how they present, you need to think about something else. And exactly, imaging is the right answer. So I think, sometimes I think people think like it presents in so many different ways. I mean, if you're sitting with an endocrinologist and your eyes are bulging out and you have thyroid problems, you're like, oh, okay. But if you're not, it can be subtle, and so people don't know. And I think it leads to the decreased mood and anxiety and depression that comes along with thyroid eye disease, like Christine was saying. So that's why I asked you guys that question, because I think people need to know like what questions to ask to say, hey, could it be this?
Yeah. So this is part of our education too in the TED community, where we can better prepare people for their visits to the doctor. And the other part of that too is that this is in any disease state, is when something's wrong with us physically, we tend to think, okay, the answer is to get to the doctor and to get the help I need, period. But what we find with thyroid eye disease is we have to become our own advocates. Is that it's not like a one-stop thing, like we just find a doctor and now our problems are solved. In fact, Jackie and I were recently at a conference with ocular plastic surgeons who had a keen interest in TED, and there were dozens and dozens of physicians. And one of the sessions is they were presenting particular cases, and then people from the audience, which are the surgeons, they said, "Oh, here's how I would deal with it." And then but you found that each person had their own different way to deal with it, that there was not one just set way. And then Jackie leaned over at one point, she says, "I would not go to that person." Me either. So you really have to advocate for yourself, that it does help to be around other TED patients. It's like I find at the locker room in the sports center, I have learned more things in that locker room just by listening to other women's experiences. That, that is not to replace a physician, but that the value of the shared experience of people who have, walked that road, and, it's invaluable.
Getting second and third opinion seems to be just sort of a baseline experience for most of us who have this condition. And from the physician perspective of it, your physician, the best physicians are going to roll with you asking for a second opinion because they're all about you and not about them. And so I would say it's a red flag if you're uncomfortable asking for a second opinion, because you deserve it. And if you're not getting a clear answer and a clear plan or something like Jackie mentioned, one might not be comfortable with, then there are other people out there that you can use their brains. I found that reaching out directly, I reached out to someone at Mass Eye and Ear. They got back to me immediately. I reached out to people at Mayo. They got back to me immediately. And both of them basically offered, of course, I'm happy to see you, So I think the professional community wants to take care of us, but it can be hard to find the right access. So I agree with Christine, you have to be an advocate here.
Definitely.
For sure. Because I also had 5 different doctors throughout my journey, and still do actually. But I started off with the optometrist because my eyes were dry. They felt like I had sand in them, Then they were starting to get red. And, he gave me eye drops. Everything's great. You're just going to be fine. Take the eye drops for, 4 days. Everything would go away. Well, it didn't. So then I, call and I said, should I go to the ophthalmologist? Yes, I think you should. So now I go to the ophthalmologist. Now get ready for pandemic's going to start because again, this was February. Okay, so he gives me steroid eye drops. And oh my goodness, I could hardly even use them. I only think I did it a few times because they burned my eyes because my eyes were super sensitive, So yeah, it's a community. I think you really need a community because everybody's journey is different, a little different. And it really, to me, it's helpful to reach out to some other people and just hear what they're doing, like maybe what kind of eye drops do you use? Or, do you have to sleep sitting up, because I had to do that for a year, just because the swelling would get worse if I was in a reclined position. So.
I mean, it's helpful during the therapeutic phase too. If you're on systemic steroids, and a lot of us have been on long courses of systemic steroids, that will make you totally loco. But at least having someone to get you in that manic state is quite helpful. And something like Tepezza too, which is, has changed the course of the disease for a lot of us, but is not without side effects. And when you're in it, it's an IV infusion with lots of systemic side effects. So it's sort of like chemo without the threat of death. It's just the threat of your eyes being screwed up. But there are significant side effects, and being able to bond with people over that is quite helpful.
Not only the side effects, but even having the infusion. So I had never been sick. I'd never, hardly taken any kind of medication. And now I need an infusion. I was petrified. I didn't know anybody to talk to. And
Yeah.
it's like, how's it going to feel?
Yeah.
Yeah. So.
It's exhausting. I had I think my like 30th infusion, if you include everything, recently. And it's just exhausting emotionally, physically. to go through it over and over again. So like I said in the beginning, I think about it like a marathon.
Mhm.
Yeah. It's
It's
a
a
good way to say it. Jackie, I was wondering if you could say something too about the TED art program and how, like that, like Nathaniel was saying, it's just really great when there's other people that you can talk with about either your treatment process or just emotionally what you're going through. But could you say something? Because it's the art, if you go to our website, thetedcommunity.org, you're going to see a lot of art. And that really, that's all points to Jackie. It's not all her art, but
No.
she really heads it up as far as, she's our cheerleader. So would you say something about the TED art?
I would love to. So to us, we get together because it is not only therapeutic for us in general, just to get together with somebody else. And we do this online. So we do it, through a Zoom call. We all live all around the country, you know. And it's just nice to be able to see someone, you talk, and then we usually have a project, far as what do we want to do. So I usually send out the information on that. Um, and usually it's, tied back to specific things. Like we had one that was inside out, like how did you present or how did you feel on the inside versus how you presented yourself to the outside world. So we've done things like that and painted some rocks, for Graves Awareness Month, with inspirational uh, things and everybody did something different, flowers or, bright colors. Anyway, it's just a nice, relaxing, enjoyable gathering that we get together. We do it once a month, the third Saturday of, each month. So please check out our website and join us for TED Art.
That's wonderful. Sorry, I think Nathaniel may have jumped in there before you. I don't know if you're
No,
going to say something.
I'm good.
Well, I think, we've talked about a lot of, really important issues and some ways to kind of help, kind of walk yourself through this process and finding support. I do want to maybe touch a little bit on, ways that maybe you've kind of regained parts of your life since, managing your TED, since treatment. I know we've kind of touched on this in a few different areas, but maybe we can kind of expand on this area a little bit.
Yes, I do want to say something about that because we have like it's maybe particular to us in the TED community, but we want to know if NED is possible. So those of us with TED, we're heading in the direction of NED, and I mean we may get there, and that for us is no evidence of disease. And so we want to know, like as TED patients, where our agency is. And so along with the medications, we want to know, can we participate in our own healing journey? So Dr. K told us, of course, you don't want to smoke. Okay, so no smoking. But this is an autoimmune. So what about our immune system? Can we do things? Is there anti-inflammatory diet? Does it matter what we eat? Does it matter? Like I swim the mile each day. Is that helping me? Is that knocking down some of that inflammation? Turns out it is. And what about this whole social? Like we have better mental health if we're social. How can you be social when you have TED? I don't know. Let's find out. What can we do? And the emotional, when you look in the mirror and you just think, I'm shutting down my life. I can't go out there like this. Well, let's see what you can do. Like, is there certain kinds of makeup? What about sunglasses? What about, how can you navigate? How can you not have to be sidelined because you have, like Nathaniel said, something that's not even your fault. And now you've got to be sidelined, pushed off to the side. And then you're watching the world participating in their own lives and you're sidelined. And it's like, no, how can you stay out there? So we think in our idea, we don't even know if NED is possible, but we're going to head for it. And then we're going to see, along with all of our wonderful partners who are working on solutions for TED, or have solutions for TED, can we do our part? And is it possible that in combination, that we can get to the other side? And then maybe for some of us, go on with our lives and live a full life. And for others of us, turn back and help those that are still lost in that dark cave of TED, because we know where they are. We know, we can go in there, take them by the hand and lead them out, because we know where that, that dark place is, that dark lost place. So we're a little bit disruptors like that, because you wouldn't just think we're just TED patients, but really the people I have found, I don't know, I don't think it's particular to the demographic of TED, but very, very bright, innovative people seem to be within the TED community. And we start talking about these things, and it's just like all the lights turn on, and it's really phenomenal. It's just, to me, it's an incredible thing to be a part of. So it's not just like we're friends, it's like we're friends and we're going somewhere. And it's just so exciting to see and be part of.
And and thinking about like how it managed, right? I'm thinking of some of the stuff I lost, and now, how exciting it was to be able to do it again, like driving, or I can go outside now in the sun, with sunglasses always, but I can do it without a hat, you know. So these are like milestones. So it's kind of nice to share that too with somebody that understands what's happening.
Yeah, victories.
Mm-hmm.
I kind of found myself quite a bit lately, maybe 3 different people in the last 3 to 4 weeks, that in my normal daily activity, being in the store, Monday I was took my father to the doctor and presented with these people that have thyroid eye disease. I mean, clearly their eyes are bulging, and I get this feeling like I can't not say something. Like, I have to approach them. And the question always is, okay, how do you present that and get them to talk and to trust me, so they don't think I'm really completely crazy. But just Monday I did. The lady was walking out of a primary care physician's office, and her eyes were they were bulging. And I seen her go to the elevator, and I couldn't sit still. I had to run. Jumped out of my chair, and I went out and said, "Hi, I just want to have can I ask you a question?" And I said, and then I started that time. I presented with, "Oh, I've had Graves' disease and thyroid eye disease," and she said, "Oh, I have Graves' disease," and I said, "Well, your eyes are a little forward. Have you had your eyes checked?" And blah blah blah. But she was very welcoming, and I was able to give her some information about TED community, to maybe direct her there. And we talked briefly about her getting a neuro-ophthalmologist in the area, as I had the same conversation with other people that I have just run into in the stores, which is quite a surprise that I ran into 3 people in about 3 or 4 weeks. But I have to say something. I can't, because I would have wanted somebody to say something to me or approach me, even though it may seem kind of awkward. But I just do it with a smile, and hopefully they're going to be engaged with me. And believe me, if I have to pull out a picture to show what I look like, I would do that. There aren't very many, but I would do that to know that I was somebody. I think that's an important thing.
Yeah.
It's very rewarding to do that.
Mm-hmm.
It's a
Very
risk,
cool.
but it's rewarding.
Yeah.
So
Very
far, I haven't
cool.
been wrong. So, and one of them was a male, though. One person was a male, and I said, 50% of people that have Graves' disease can end up getting thyroid eye disease. And I said, your eyes are forward. And he goes, yeah, I know, I've been told that. And so I talked about having dry eye and blah, blah, blah. And, how people may lose their vision if it's not treated. And he said, you're not the first person that has said that to me, so maybe I should get it checked. So I felt good about him.
Mm-hmm. Nice.
Yeah, because what they usually say, what the lady said on Monday, she said, but your eyes look good. And I said, well, I did have surgery. I did end up having some strabismus after all of my treatments, but I didn't have, my eyes had to be balanced out a little bit more. So,
Mm,
but I
mm.
found that rewarding.
Well, I think, before we wrap up here, I do want to ask everyone one last question before we move into our kind of audience Q&A here. And this is kind of the question that I always like to end a discussion like this with. And it's, what advice would you give to a TED patient who's just starting their journey? What's maybe the one thing that you wish you knew, or the one piece of advice that, you kind of learned along the way that you were like, this is really what has kind of held it together for me, anything like that. So maybe Christine, if you'd like to start us off.
Yeah, I would just say don't do it alone. Don't try to do it alone. Is that reach out for help. It can be in the medical community, but also, again, the TED community. We're super easy to find, tedcommunity.org, and very welcoming, safe place, but don't do it alone. Yeah.
Jackie?
I'd say, living with TED it's a journey, but it's filled with challenges, but it's also a journey of resilience and strength. And what I did is I wrote hope on my chalkboard in my kitchen, and I looked at it every day. So if you write hope, vertically down, and I wrote it out as have only positive expectations. So it's something I saw every day. Every day I looked at it multiple times a day. And I just want you to know that you do have resilience and strength with TED.
That's wonderful. Nathaniel?
Yeah, it's a nice affirmation, Jackie. I mean, I think, well, at least from my brain, I think I have it two pieces of advice. The first is to find support, and there is an organization that gives a lot of support. We've talked about that today, so that's there. Just to give you an example, within a week, I got paired up with two people, one who was a man with TED who's in England, who's a biomedical researcher, and then another who's a dentist in Texas. So share professional background, and was able to have one-on-one talks with them. So sort of branching out from a group support to individual conversations, which was really helpful. And the other was to just get informed. So it goes back to my idea of getting second opinions if you're still having questions that are unanswered, and becoming as informed as possible about this disease. Many folks in the medical community just don't get it. They've never heard of it even. I mean, now we're calling it thyroid eye disease, but it was Graves' ophthalmopathy for a long time, and that's a misnomer because you don't have to have Graves to have it. So there's just a lot of people that are going to be less informed than you, and you have to advocate for yourself, and so get informed.
Yeah, super important point. And Gail?
I would just say ask a lot of questions, along with what Nathaniel just said, is to get a second opinion. But if you're not settled with the answer that you receive from your physician, ask it a different way. Just ask questions. I did it a lot. I wrote down my list. I let my physician go through and do all his tests, tell me what, if anything changed. But there wasn't an appointment that I didn't go through where I wasn't pulling a piece of paper out of my pocket. And I didn't care how many were on there. He answered every one of them, and answered until I was settled with the answer. And I think that's the most important thing. Don't leave because you think he's on a 20-minute schedule. My appointments, thankfully, were scheduled for an hour. And I used every minute of it. And I asked a lot of questions. And I think it's very important to empower yourself.
And take a notebook.
Absolutely. Yeah.
Yeah.
I went back to my doctors, every one of them that didn't diagnose me or run the proper blood work that I needed to find out that I had a thyroid issue. And I took it as an opportunity to educate them, including my primary care. And that meeting will stay with me forever of how that went.
And
I-
that was courageous. I'm so happy you did that. That was like,
I couldn't do it right away. I had to wait a period of time until I wasn't upset about the situation and I had already dealt with what was happening. And then I felt like, okay, now I'm in charge. I took it as an opportunity to educate him. And so he knew what to look for. I went back to the first eye doctor and, I felt comfortable in doing it and just going back and the one eye doctor that I went back to looked at me and with a straight face and said, I have people that come in here that look like that. Well, now you know how you can have them referred to a physician that really can help them. That is a TED specialist, and that's the most important thing. And have the thyroid taken care of. That was really a critical part too.
Absolutely. Well, I just want to say thank you all so much for this wonderful discussion. We do have some time for audience Q&A here, so if you do have questions, please feel free to submit those through the Q&A feature. We do already have an audience question, and I would love to hear from our kind of patient panel here about their thoughts here. But we do have a question about recommendations on how to share with family, with employers, with friends about your symptoms so they can really understand it, so they know you're not making it up, and kind of really explaining your experience.
Well, I wasn't working at the time, so I didn't have that issue to deal with. I kind of closed a lot of my family out, to be honest, except for obviously my immediate, my husband, who saw me every day. My daughter lived out of state, so we just FaceTime so she could see through that. And then my son lived with us, so he saw what was happening. So I kept my circle very small, which maybe in hindsight wasn't the best thing I could have did. But I think if I had to do it again, I don't know how much different I would have done. So I don't really know how to answer that, but that's a great question.
My thought is again about being informed. There's this idea that I don't have much experience with, but I think it's like the 10-second business pitch. Like if you have something, you should be able to like pitch it in 10 seconds in an elevator, to sort of like get your main point across. And I might practice that 10-second pitch for thyroid eye disease with just the big hitters. And to the question about like, people understand that you're not making it up. Once you hit them with a few hard facts, an autoimmune disease that's affecting your eyes, 8% of cases cause blindness. There is an FDA-approved treatment, and it can cause double vision and all the rest of it. People should get it. And if they're curious, they'll ask sensitive questions.
yeah. And in my case, I got it just before the pandemic. So I really was still in the office and the lighting was bothering me. My eyes were red. My manager, he saw my eyes and he even asked me like, what's wrong with your eyes? They were starting to swell. And I told him it was the lighting. I didn't know, da-da-dee. And I had all this grittiness. So then pandemic happens, right? And we used to do Zoom or, basically video calls. And I would tell them, let's do crazy hat day or let's do crazy glasses day, on the meeting because I didn't want them to see me. Right. But my boss was very understanding. So I get what this person's asking. I think you just have to really tell somebody the symptoms that you're having and then what the disease is doing. And I mean, I did Zoom or calls with my friends that live out of state, and I did let them see my throughout the journey. But then other times I would wear the sunglasses, but they would actually see it. I think you really need somebody to see it in your family or your friends, and let them understand it. And it's hard to do. It is hard to do. But hopefully most jobs and families, are understanding to that because it is more than just what's happening to your eyes and the pain, but the mental side that you're gonna maybe experience also. Mhm.
And two, if people are really, like, if it's family member and they're really caring about you, you know, again, like, we have a lot of resources on our website, like personal story videos. We have a lot of science there. We have infographics. And so for them just to spend a little time on our website, listen to some of these stories. So it takes a little bit of that personal, you know, part off of it. Like, so it's not just you. There's a whole community of people who have this condition, and it might spark them with questions like, oh, is this what you're going through? Or I listened to this one podcast and that just sounded like really a rough thing. Is that what you're going through? So you might, like, you know, to remove it like one step from yourself, if that was like too hard to communicate, you can point them in that direction and say, if you would like to learn more about what I'm going through, you can go to this one website and you could find a lot of information, and it might just really open their eyes a lot more than just, you know, it being you, that there's a whole dynamic to it.
Wonderful. And Dr. Kachikian, I don't know if you have, you know, other advice too that you kind of pass along to patients that as they're on this journey.
Myself, one of the things that I have learned that, you know, and this is why I got into being a thyroid eye disease specialist, is in hindsight, I feel bad now that I know so much more about it that I didn't ask my patients about it more, or even my patients who've had it for a long time, they may not have terrible disease, but they still suffer from a lot of different aspects. And I feel like, you know, it was like, and there's the stigma. I was like, oh, it's somebody else's issue. I don't know what to do. So I think that's really important. The other thing that I often tell my patients, or what I've heard from stories, is you can say, um, so I have thyroid eye disease. It's not a new disease. It's been around for a long time. It's a disease where my immune system attacks my eyes, and it affects a lot of things that you know you may take for granted. Every day is not the same. Um, and as a baseline, just say oftentimes I'm irritated or agitated or may not want to do things. And it's not because of anyone around me. Sometimes it's my own demons, and it's all the, you know, everyday struggles that I deal with. It is all the different privileges that the rest of us oftentimes have that, like, don't get noticed by other people, or B, rob you of that autonomy, which I think is you know, it's terrible. So I think that's what I would say. At least, and I always take every opportunity I get from my patients to learn a little bit. And every patient who I treat, I always ask them at the end of it, I'd say, okay, so if we were to do it again, all the good, all the bad, all the ugly, and Nathaniel said it too, like, it's not just a walk in the park, so you have to pick the right patient, but just say, would you do it again? Or what's one thing you would do differently? So it's a constant evolution for everybody, for patients, for providers. So
Well, that brings us to about the end of our webinar here at Time. I just want to extend a massive thank you to our patients, to the TED Community Organization, to Dr. Kachikian, all for joining us this evening, as well as our attendees. Thank you so much for taking the time to join us. As Christine mentioned, you can find a lot of the TED community resources at tedcommunity.org. The Vision Health Advocacy Coalition, you can also find us at visionhealthadvocacy.org. We have quite a few resources online. So thank you all again so much for joining us this evening, and I hope everyone has a wonderful rest of your evening.